Hello, my name is Kristin Grayce McGary, and I'm an integrative and holistic healthcare practitioner. I'm a licensed acupuncturist. I'm certified in functional medicine, advanced cranial sacral therapy, somatoemotional release, herbology, homeopathy, a very specialized brain technique, the lifeline technique, neural therapy, perineural therapy, lots of different techniques, lots of modalities that I've mastered over the last 23 years of training and practice. Before that, I was involved in Western medicine. I was an EMT, nationally board certified. I volunteered in the emergency room. So I was pre-med, and I was really on track to become a Western trained physician. And then through my own healing journey, I got very, very sick as a very young person. And through my own healing journey, I shifted from Western medicine to Asian medicine and functional medicine, and really the connection of mind, body, and spirit in a very unique and holistic approach. And I'm here in my Facebook Live series during this pandemic of COVID-19 to inspire and empower you on all things health and wellness, mind, body, and spirit. And today, I'm speaking about a topic that is very, very important that I'm really excited to share with you so that you have more knowledge and can take appropriate action in your life. And I talk about this quite a bit in my second book, which is called Know Your Blood, Know Your Health, Prevent Disease, and Enjoy Vibrant Health Through Functional Blood Chemistry Analysis. I also mention it in my first book, Holistic Keto for Gut Health, a program for resetting your metabolism. And I talk about the immune system quite a bit in that book, how to repair the gut. It's not just a keto book, but it does have great recipes in it, keto and I call them transitioning recipes. And so my third book, which you will not be able to read till later next year, is on blocks to healing, and I go even more in depth into body burden in that book. So I'm going to explain a bit about body burden today. So body burden, think about it, a burden on your body. Think about how that doesn't sound so great. Well, there are a lot of things in your everyday life that may be burdening your physical body, your energetic body, your emotions, and even your mind. I'm going to start with physical body burden. We may not think about some of these things, but there are things in our environment that we can accumulate in our bodies. So, of course, optimally, our livers are always detoxifying and cleansing. Our kidneys are purifying and cleansing. Our spleen is cleansing and purifying red blood cells and white blood cells, and all sorts of cool things are happening, ideally. But often we can come into the world already with body burden. So I'm not a big fan of doing like a big massive detox. I think we should be living a more detoxified life every day and just not introducing more. And that way our bodies can naturally detox. Now, all of our organs of elimination are really important when we talk about detox, and I'll talk about that later. But I want to mention that. So I'm going to give you an analogy so you could better understand body burden. In fact, I might give you two analogies today so you can start to understand body burden. And I originally learned part of this analogy from a good friend of mine and colleague and mentor, Vanessa Morgan. And in my first year of Asian medical school, she introduced this concept of body burden. She's an acupuncturist, but she's also a homeopath and works with biological medicine and all sorts of great things. She's brilliant. And she works with miasms quite a bit. And she said, it's like a backpack theory. I said, okay. She says, when you're born, imagine that you're issued a standard issue backpack. So just imagine you got your backpack on, you're a little baby. And if your mom ever ate tuna or salmon, or if she had mercury dental fillings, that those toxins, those chemicals, those heavy metals actually go through the placenta barrier. We know this already in science. That means that little baby has those chemicals. If she did not eat organic, she has pesticides and different chemicals that pass through the placenta barrier and actually go into the baby. And so even a baby born with the standard issue backpack in your imagination already has some toxins in their backpack. So just imagine that. Then let's say this child gets vaccinated, which is very common, standard practice. Well, that's actually a burden on an infant. It can be a burden on an adult as well. And I'm not going to get all into vaccinations, but I'm just talking scientifically, it's a burden to an underdeveloped immune system. And here's why. It's bypassing all of that baby's natural protective mechanisms, like mucosal membranes. Our body was designed to catch things in our mucosal membranes and then signal the immune system to take care of things. And so if something is implanted, embedded, and it bypasses your natural immune defenses, it can cause a real stress on the system and accumulate in the body. The body is not meant to deal with more than a few pathogens at once, even one pathogen at a time. And so when you give multiple pathogens and you bypass the natural defenses, then this can cause a real challenge. Well, guess what? That goes into the backpack. Now, if there's mercury in those vaccinations, which there still is mercury-laced vaccinations, it's a preservative, guess what? Thimerosal goes into the backpack. Now, let's say that child, as a toddler, grows up and now gets a sore throat, maybe a fever, mom's very scared, maybe mom didn't have very good tools or medical support, say to look at this more naturally, and mom gets antibiotics. No blood test is done. We don't know if this is viral or bacterial, but mom gets antibiotics from her doctor, gives it to the child. Well, guess what? That's a burden on the system. You've just suppressed the immune system when you take those antibiotics, and you're often suppressing that bacteria or virus, and that goes in the backpack, and it can get stored in other places. Let's say child gets a fever again, mom's giving acetaminophen. Oh, guess what? That can prolong you from healing an illness. It can prolong the illness and cause other stresses in your immune function. Oh, that goes in the backpack. Then let's say the family isn't eating organic all the time and there's lots of chemicals and pesticides. Oh, that goes in the backpack. Let's say that child is eating processed foods with chemical preservatives and additives, food coloring. Oh, that goes in the backpack. Let's say because this child ate a lot of sugar, its mom and dad didn't know much better, didn't understand that sugar was bad. Oh, now this child is 6 and has 2 cavities. And they fill them with silver, mercury, amalgam, because that's all the insurance will pay for. Oh, that goes in the backpack. That's a heavy metal, and every time that child chews, mercury vapors are being released into its brain. Backpack. And let's say mom doesn't know any better and she's cleaning the house with bleach. So there's a chemical exposure every single week. Oh, that goes in the backpack. Let's say this child has a really significant fall. He's riding his bike now. He's 8 or 9. We'll call him a him. He's 8 or 9, and he has a really bad fall. He needs stitches. He hits his head. That trauma, guess what, goes in the backpack. It was not resolved properly. They didn't get anything natural. They got stitches, of course, because it was appropriate, but the anesthetic they used, maybe he had a reaction to it. It can go into his backpack. The trauma to his fascia and bones, muscle structure, he hit his head. All of these things are unresolved because they weren't necessarily dealt with in a holistic way to allow the nervous system to process them more appropriately for that individual. In the backpack. So you're kind of getting my sense that now this child is like 12 and he's got this huge, heavy backpack of all this stuff that's been unresolved. Well, now let's talk about some emotional stuff that might be going in this backpack, not only the physical stuff. So now let's say parents are fighting all the time and they get a divorce. And this kid is devastated and pissed off, and he's going to become a teenager. Guess what? That emotional trauma, stress that didn't get resolved properly, in the backpack. Now this child, let's say he's growing up, now he's in high school, maybe he got bullied, that goes in the backpack. Maybe he really liked a young woman, a young girl, and she rejected him, and he's just horrified and embarrassed and shaming himself, and he doesn't have a good support system or places to go for empowerment or mentorship. Guess what? In the backpack. Wow, now this kid's in college, like his backpack is so heavy. This is an example. This is the analogy of body burden. We all have body burden. Unless you're an indigenous tribal person living off the grid your entire life in a pristine part of the world where there are no chemicals and agriculture is only done naturally, and there is no weird wind currents that might be blowing any chemicals to you, and you have to be living over the perfect place where the ozone layer is immaculate and not dissolving, and your water is super clean. I mean, everybody has body burden. And so it's the accumulation of toxins, chemicals, stressors that can actually accumulate in your tissues. Some of it's measurable and some of it's not. We can measure certain chemicals in the blood, in the urine. Some people do hair analysis. I think that's not very comprehensive and subject to too many variables that could make it inaccurate, but occasionally I have been known to use that in combination with urine and blood tests and provocative agents to see what people are excreting so we can measure it, so we have a better gauge of what things are out of balance in that person, and then we connect this with their symptoms. So this is body burden, and a lot of people don't understand how much they're actually carrying and how stressful this can be for your metabolism, and in the day of this pandemic, for your immune system. Dealing with body burden greatly increases immune function. It also really, really impacts your endocrine system, your hormones. Ladies and gentlemen, if you've had exposure to plastics, residue of plastics, which most people have, you can accumulate these fake plastics, these plastics in your system, and they mimic estrogen. I call it a fake estrogen. And it can screw up your hormone system. And this can be part of body burden. And doing just a liver cleanse is not enough. Now, sometimes we need to detoxify the liver. The liver conjugates estrogen, just to tie it into that example. So that could be very important. But if you simultaneously need to deal with the kidneys, you need to deal with the colon, the digestive system, the lymphatic system. These are major organs of elimination. And when you're working with body burden, you need to work with a trained professional who understands how your body needs to detox. Sometimes we do genetic testing. Sometimes I just look at a functional blood chemistry analysis and I can understand a lot of what's going on. It's not rocket science, but it is detailed. And I don't expect you to learn it all yourself. That's why you have healthcare providers like myself that work very, very comprehensively to identify what the best way for you would be and what layers you may have in terms of exposures. I'd like to share one other analogy briefly with you. And this also came from my dear friend Vanessa Morgan, and it's just brilliant. So imagine your desk, and right now, you probably are at home looking at that desk because you're in isolation and you're thinking, I should go through all those stacks of paper on my desk. Look at all those old bills, old magazines, old newspapers, all that junk mail. You've got these stacks on your desk. So here's how it works in your body. When you have an exposure, it's like a piece of paper going on your desk. Now you have another piece of paper, then another, and then another, and another. And in your life, pretty soon, your desk is filled with these stacks of paper. Now, your body is not going to just go in the middle of a stack and pull out one piece of paper. All the piles are going to fall. It's going to be a mess. You're going to feel terrible. But your body does understand how to prioritize. And I trust your body's ability to prioritize. When it's given the proper support and we identify what's really going on, we can peel off the layers of toxicity as if we're going through all the papers on your desk. You would never pull out the bottom paper. Sometimes there are some health providers that don't understand how to help you properly detox, and it's like they just pulled out the bottom piece of paper, and you get super sick and you feel horrible and you wonder what's going on. Detoxing doesn't always have to be super painful. Sometimes it can be uncomfortable. Sometimes you can hurt, you can have a detox reaction, but a lot of times your body can handle it when you're given the proper guidance, the proper supplements, the proper recommendations. And so with body burden, it's really, really important to work with someone who understands all of the details of how the human body detoxes and how to give you the proper support so that you do it well and completely and you don't get sick and feel like horrible. Okay, are there any questions about body burden? Now is the time to ask me. You have me live here on Facebook. If you're listening to this later, I'm doing my best to go through all my Facebook videos like once a week, maybe twice a week. Sometimes I'm not shown everything right away and I have to really hunt for it. So if for some reason you ask a question and I don't get to it, please DM me. Send me a private message or reach out to me in email. You can find my email on my website, guthappyketo.com, guthappyketo.com. If you're interested in working one-on-one with me, I have a very special offer that I am finally launching this coming next week. So today's Friday, so I'll launch it on Monday. But I'm going to give you a little teaser today. And I am going, during this pandemic, for the next 30 days, I'm going to be offering a 1-hour consultation over Zoom remotely with me to answer all of your health questions and help you get to the root of current symptoms, to give you guidance, to help you up level. If you're feeling tired, if you're unsure about your immune system, if you're ready to make some changes and you want some guidance, you're ready to level up your health in your life so that you can emerge from this pandemic even stronger and healthier, then I am here for you. So I'm going to be launching this offer next week, and I'm really excited to meet with you in person and to share all of my genius with you so that you can be inspired and empowered around your own health and life and share it with your family and your friends. All right, that is all for today on body burden. I'm going to, let's see, let me get my list. Hold on. Got it. Tomorrow, I am so excited. Tomorrow, I'm going to be talking about insulin resistance. What is it? What do you do about it? How do you know you have it? All of that good stuff. So tomorrow, insulin resistance. Catch me here. Thank you so much. Blessings and happy Friday. Bye for now.